Let's talk about urinary incontinence and what is urinary incontinence. Urinary incontinence is the involuntary loss of urine or bladder control. And over 25 million American adults experience incontinence per year. Isn't that pretty crazy? Now, what causes urinary incontinence? It can be caused by multiple things like changes in your body, underlying medical conditions, everyday habits, or physical problems. Now, there are 6 types of urinary incontinence, and the first one is stress incontinence. Stress incontinence has actually nothing to do with emotional tension, as the cause is purely physical. Just like, do you ever pee just a little when you're laughing, coughing, or doing any sort of workout? Well, that could be a cause of stress incontinence. It's also very commonly found in women that just gave birth or the elderly. Second incontinence is the urge incontinence, or just the overreactive bladder. Unlike stress incontinence, urge incontinence is just the constant urge to wanting to pee even when the bladder is not full. This also impacts women and men and is a result of an overreactive bladder. Third, mixed incontinence, which is actually the combination of the first incontinence, stress incontinence, and the second, urge incontinence, which is found to be common in women, but men if they've had a prostate removal surgery. Fourth, overflow incontinence. Overflow incontinence is not ever having the feeling of needing to pee even when your bladder is full of urine, therefore causing to leak out. Fifth is a functional incontinence. Functional incontinence is when your urinary tract is functioning properly, but outside factors make it to leak out. Examples including medication, mental illness, and inability to find a toilet when needing to go. And the last one is reflex incontinence, which usually occurs in people with a serious neurological impairment, including spinal injuries, MS, or damage from surgery.